Ladies and gentlemen, federal workers and injured federal workers, Riverdale Wellness proudly presents to you the Injured Federal Workers Podcast. Good afternoon, everybody, and how are we today? It's Dr. Mark Eisen coming to you from the Riverdale Wellness Studios in New York City. How are we? So let's talk. Number one, as you know, we have this podcast going, and the podcast needs you guys to subscribe. We need you guys to like it, and we need you guys to share it with other people. Why? Very simple. The liking and sharing gets the word out, helps other injured federal workers. So please subscribe it and share it. Okay? That's how we get the traction going, to educate, to inform, to do a good job with everyone. Okay? Let's just begin there. Next thing. Email me your questions. There are people out there that have questions. Injured Federal Workers Podcast at gmail.com. Email me the questions. Tell me where you're from. Tell me what the issue is. We'll try to answer your questions the best that we can. Okay? So please, subscribe, like, and share. Second, email me your questions. And third, let's get to our show. So, some people are visual learners, some people are auditory learners, and some people are kinesthetic learners. Visual means that you see it, you learn it by seeing it, by watching it, you understand it that way. Some people are kinesthetic learners. That means they're touching it. Sorry, I screwed up there. Let's continue. Auditory learners, they're listening to you. Right? One's seeing, one's hearing, kinesthetic is touching. So, with that being said, let's get to something that I think will help everyone out, because what we're going to do is we are going to follow a PowerPoint presentation on federal workers' comp. I think at this point, I think it's important. What you should do is pause it as it goes along so you can see the data. You can screenshot it for yourself if you need to, okay? And again, you're doing this for one reason, because it's going to help you out, okay? So let's get right to it. Here we go. What do you do if you get hurt? Oh, look at that PowerPoint presentation. What do you do if you get hurt? So, step one, stop what you're doing, right? We talked about stop, get evaluated, and then get cleared. Look for witnesses. Solidify half the components of fact of injury. Okay? Well, if you just bear with me, you're going to see why I'm saying it. You're then going to notify your supervisor. Okay? You're going to either fill out a CA1 or a CA2 in order to get that 9-digit case number, as well as to qualify for the beginning parts of COP. I should have put COP here. Get a CA16 for authorization to examine and treat, and then get evaluated. So we said stop. Then we spoke about looking for witnesses, notifying your supervisor, getting evaluated. Okay? Let's just look at this for 1 second, okay? This was something that is sent to every doctor if the paperwork is not sent up, and they allow 30 days from it being completed. Did you file timely? So as soon as you got hurt, did you file it timely? Right? Notify the supervisor to get a CA1. That's filing timely too, isn't it? Next is, are you a federal employee? Okay, so this workshop is meant for the federal employees out there. Okay? Now, we just said over here, look for witness, solidify half the components of fact of injury. So what are the two halves? Which is both a factual and medical component. Wow, Dr. Eisen, you really outlined everything for us. Factually, the injury, accident, or employment factor alleged must have actually occurred. They can't argue it if you have a witness statement, right? That's half of it, right? Then the second of is medically a medical condition must be diagnosed in condition with the injury or event. We're taking their words and giving you what they want. So you have to have a condition, a diagnosis, right? Next. This is an example of the CA1, right? You filled it out. This is the witness part, right? We spoke about COP before on other workshops. This is your data, who you are, where you are, how the injury occurred. Put as much detail in here as possible, okay? We got to tighten this up to move forward. I think this will be our last discussion on the CA1. So you guys got to tighten this up. Give as much details as possible. Be specific, okay? Next, you got the COP, the witness statement. You're halfway home. What did I do here? Oh, the CA16, authorization for examination or treatment. Right? Authorization, name and address of the employee's place of employment, your supervisor's signature, and all that stuff, okay? Next. What did we end off here with? Get evaluated. How do you get evaluated immediately? Go to the emergency room. So what are the two scenarios? What scenario one is you get cleared, right? No big deal. You know, someone asked me yesterday, you got a paper cut. Yeah. What do you think you're going to do? File CA1. How do you know an infection doesn't arise from that cut? If it's metal, what do you know? I call it a paper cut. Cut your hand. You think it's no big deal. What happens if there's an infection that occurs? Now you got to go seek medical attention for it, right? In the beginning, you think it's just a cut. What happens if there's a bacteria there? Let's discuss, you know, bacteria and viruses, you know, COVID and all, but we'll stay out of that one, okay? So get examined and get cleared, okay? Now, if you don't get cleared, you got to get further evaluated. And usually the emergency room will say, you know, if it's a little bit more serious, go to your primary care or go to a specialist. So go to the OWCP doctor, a special doctor who knows OWCP. Next. Okay, so now you're going for your first visit to the doctor. So what could you expect? Remember, you don't have a case number yet. You know, unless you're going 3-4 weeks later, shame on you. Shame on you for not going immediately to the medical doctor. Why? Is your case very believable that you got injured on Monday, July 1st, and you waited till August 1st or July 25th to be seen by a doctor? Come on, okay? So I really don't want to talk to you then, if that's the case. I don't care what you're going to tell me. I couldn't find a doctor. You know what? You can find doctors. It's on the Department of Labor's website, all right? Even if you find a poor quality doctor. The doctor will take your history and gather the facts of the injury. The doctor will perform the physical exam, okay, on you. If the doctor wants to order x-rays, MRIs, or other tests, you'll have to wait because you don't have a case number yet. So you want to get that doctor your case number ASAP so they can order your tests if necessary. And if the doctor wants to send you back to work, great, you got cleared, right? But if the doctor wants to keep you out of work, get a note and follow up. You want that note because when your case gets accepted, we'll talk about travel money, we'll talk about other such things. You want to always have proof that you're doing everything that you needed to do to get your case approved and to do it the right way, okay? Now, because you don't have that case number, you're lucky you found a doctor's office that will take you, right? Because they'd want you to wait for your case number because are you believable? It took you 3 weeks to get a case number. I mean, we saw someone recently who came in and, you know, we saw them without their case number on the first visit. And 4 weeks later, they still didn't have a case number. That meant a couple things. You're not doing your end of it, or you never filed the CA1 to begin with, okay? Or something else. Okay, between visit 1 and 2, get your case number, get to the doctor, make sure the doctor is able to get your tests done. So that by visit 2, you've already discussed the next set of recommendations. And if the doctor tells you to follow up with specialists or a therapist or physical therapy of sorts, follow their advice, right? You want to show everyone that you're trying your best to get better and return to work, okay? This is a serious matter. This is legal, okay? Let's do it, people. Let's do it the right way. On the next medical visit, you're going to review your diagnostic report, your medical narrative. Give me an example. Someone comes in, they say they got hurt, they order the MRI. The doctor should read the MRI report to the person and have them read it along with them, so they know what their diagnosis is. They know what the MRI is saying. So someone can't say to you, hey, wait a minute, buddy. You didn't tell me there was something more serious going on. There is nothing more serious going on. It was in your medical MRI report that you took. There isn't much left. Okay? If either report aren't ready, then follow up again with another visit to the MD. Remember, there's a time frame for timely filing. Okay? Let's just go back. Okay? What does it say here? Timely filing. Get your stuff done. Show that you're serious about this. Okay? Don't forget to have the MD fill out a CA 17 and 20 for COP. Once you get your case number and tests are completed. Okay? Because here's what the CA 17 and 20 is. Okay? Go look at them up. It says at the bottom, CA 20, CA 17. CA 17 is a duty status report. Can you lift, pin, twist, turn? It's all right here on the side. The doctor has to fill it in. When it comes to the attending physician's report, remember it says physician's report and physician's signature. Signature of physician. So when I said to you, don't see a nurse practitioner, this is why, okay? What are your findings? Include results of x-rays and laboratory reports. So guess what? You can't get the diagnosis without the MRIs, an official diagnosis without that MRI. So if the doctor wants to order, get them done, right? Because you don't have a case number yet, so you got to get your case number right away. So you can put that into your physician's report. Over here, it talks about the case number. You don't have a case number, they can't fill it out. You don't have a case number here, they can't fill that out either. Okay, so it's all connected. How many John Smiths are there? Okay, they're not looking for you in the entire world of government employees of who's John Smith. Okay, let's review. Finally, tiling. Are you a federal employee? Do you have the facts of the injury? Now you have the diagnosis. Did it happen during the performance of duty? Because if it happened at home or during a car accident, shame on you for trying to put it through to the government. Shame on you. Last but not least, establish causal relationship, which means the medical evidence establishes that the diagnosed condition is causally related to the injury or event. Okay? Great.
Do you work for the federal government? Did you get injured on the job? Did you go to a certified federal workers' compensation doctor? In order for your case to get accepted, you should only be seen on that first visit by the medical doctor, not a nurse. The history was taken by the doctor, as well as your physical exam. Your CA-17 paperwork and CA-20 should only be filled out by the doctor. For the CA-17 and 20 to be completed, you need a case number. It is a 9-digit number. If medically reasonable, the medical doctor might even order MRIs or X-rays. This is what you can expect at RiverdaleWellness.com. Please call 718-601-1540 for your consultation after your injury on the job.